Walid, I'm making you the co-host today, okay? I'm
Okay.
making you co-host today.
Okay,
So
sir.
manage the mics and all, okay? Manage
Okay.
the mic. I made you the co-host for this meeting, right? Okay. Arvind Morgan, are you there from Malaysia? Arvind Morgan, can you speak to me? Okay, since it's not there, we'll start. Harman, are you there?
Yes.
Yes, he is.
Okay. So now we'll start with the points, right? So the combination of these points is the list of Tung Acupuncture. If you ask me, Sastry, how many patients did you treat with Tung Acupuncture? I said I treated more than 300 to 400,000 patients in trial basis. So these patients, we used to go to villages, we used to go to large number of places, and then we used to treat these people with Tung Acupuncture. If you go beyond videos, many videos have been deleted by Facebook. Otherwise, it was a huge videos of hours and hours of treatment in which people could see how I inserted the needle and how the patients recovered. So we made the trial of all the points and then we could say the recovery was very fantastic. But if you don't follow the other procedures, the patient will suffer back again. Dr. Sovik Ong, are you there? Dr. Sovik? Sovik Ong, are you there? Okay. So this is 11.08. Sato Sato Lavan. So 11.8 is a 2-point location. The reaction area is what? The reaction area is lung. Now you know more important part of lung is what? If you go for the holography in etching method, the lung balances spleen, lung balances stomach, lung balances liver, and lung balances large intestines. If you see, lung balances what? Li. Lung balances spleen. Lung balances stomach. So you could see this 2-point location 11.08 with Sato 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 Duva Sato Sato Tika means 11.01, 11.02 and 11.03 along with 11.08. Write down 11.01, 11.02, 11.03 along with 11.08. Recovers what? It recovers very severe abdominal pain. So further aid in inflammatory bowel disease, PC6 and PC6, stomach 36, spleen 9, spleen 6, spleen 9, spleen 6, spleen Samilan, spleen now. Ima naam tujo, laban, Samilan, sapojo. Am I clear?
Okay, so for serious abdomen pain is 1101, 1102, 1103, 1108, PC6, SP26, SP6, and SP9. Am I right?
Yes.
Okay.
Very correct. Very good. So you have to say it what? 11.08. Further aid. Further aid. 11.01, 11.02, 11.03. Further aid. Then further aids TCM points. What are the TCM points? PC6.
ST26,
Then
stomach 26.
ST36.
Oh, not 26.
No stomach 26. 36.
Okay.
Dicabolonam.
Okay.
Stomach dicabolonam. Herman, what do you call stomach in English, in Bhasa?
Perut. Perut.
Lambung. Lambung.
Stomach.
Pandung.
Lambung.
Pandung. Pandung, right.
Lambung.
So
Lambung.
Pandung.
Not
Lambung.
Bandung. Lambung.
Lambung. Yes,
Yeah.
Lambung. So Lambung, tiga puluh enam. Lambung, tiga puluh enam means stomach 36. So can you please repeat the points?
Cool. Me?
Yeah.
Okay, for Tung point, 1108, 1101, 1102,
No.
11.
Harban, you should always write 11.08, right?
Oh, yes.
Further
11.0.
aid. Yes. Further aid. Further aid.
Yes.
11.01, 11.02, 11.03. Then TCM points.
Yes. TCM point.
What are the TCM points? Stomach 36, PC6.
SP6, SP9.
Walid, please ask the person who's making noise. Switch off his mic. Clear? So the reaction area is what? Lung. And it is used for very good for what? All these points are very good for inflammatory bowel disease.
Okay.
Now comes 11.08. $11.09. Write down.
Okay. 1109. 11.09.
Yes. Are you in the class, Arvind?
Hi, can you hear me?
Yeah. Arvind. So these are very important points if you can write down along with me. You having a pen and paper? Arvind? Can you hear me, Arvind?
Hello, yeah, hello?
Do you have a pen and paper?
Yeah, sure.
You write down. So when you will be with me in the class, okay, Arvind? So that this concept regarding you is clear to you, right?
Mm-hmm.
So here you can see this is 11 point what
11.09.
9. So yeah, these are called the distal points. The most important part is that the pain is here. You treat the opposite area, so the risk of the immediate recovery is reduced. So now the patient is having severe pain in the scapula area with lot of spasm, right?
Okay.
Now what to do? What is your possible treatment? You will go for ultrasound, you will go for soft tissue mobilization, you may go for IASTM, right? Can you hear me?
So you
Hello?
muted me just now. So you press mute just
I did not meet you. There's another person also, Walid.
Yes, sir.
Can you hear me?
Yeah, yeah, sure.
So now what to do? See, this is the needle which you have to put up from this location. Can you see my hands?
Yes. Middle finger.
Yeah, it is a middle finger, and from your palmar side, not the opposite side, right? No, it has to be inserted from the palmar side. Yes, like this. Slightly painful. So what I did, I took out to insert it in this direction, opposite side, not the palmar side, the opposite side, right? And then 11.09, you can insert with what? 1 minute. You can use further aid 11 point, no, further aid uh, mm, 1 minute. Acupoints.
Sir, your signal is choppy.
We can't hear you.
I am not speaking, so how can you hear me? Uh, you can add further stomach 36, GB 34.
Come again, sir.
Mm, write down this point 11.09. Along with stomach 41. It's the most important point. So when you go to stomach 41, it is the ankle. Can you see me, Arvind? Arvind, can you see me? Arvind, can you see my hands? Arvind Morgan? Can you see me?
I can see you, sir.
Yes, yes, sir.
Arvind, can you see me? Arvind Morgan? Walid, you may unmute his mic. So, whenever you see there is a frozen shoulder, you can add what? 11.09 along with tender points, R-shaped points called tender points. Go to the ankle. This is the ankle joint in the leg, right? Wait a minute, yes. So here you will see, this is the ankle, let us believe to be the ankle joint. Here you press and see which are the tender points. So on the opposite side, find out the tender points and insert the needles. the pain of the frozen shoulder will immediately go away with this formula. What is the formula? What is the formula?
1109 plus
Yeah.
stomach 41.
Plus stomach 36 and GB 34. The pain will immediately go away of the frozen shoulder. Then you can manipulate the shoulder joint properly, remove the stiffness, because 11.09 will immediately remove the stiffness of the scapula. So when you remove you put up the hands like this, the restricted area is what? Scapula. Vanita, switch off your mic. Clear?
Sir, question.
No.
Sorry.
Huh?
Question.
Yes?
Is it for acute or chronic frozen shoulder?
Any. Now acute chronic is no use.
I see. Thank you.
This gives immediate recovery. And now if you use the saline injections properly in the interarticular joint, saline injections like this, go like this, bend the needle like this and insert it in the joint and put this 2 ml of those who are medical doctors, they can write down the formula. See, these slides cannot give you total knowledge. You have to take knowledge from me. Slides, you will have it. But then you have to take knowledge from me because I was the one who did lot of experiments in this. Right?
Yes.
Right,
These
sir.
slides cannot teach you. Only MK Sastry can teach you.
Yeah.
Arvind,
Sir?
can you come up? Arvind, Malaysia. Yeah, write down.
Sir,
Yes.
what the last one? GB what?
GB. Tigopolapath.
GB 34. Okay, thank you.
Yeah, Tigopolapath. See now
Gallbladder.
this is called, yeah, gallbladder. Now you can see my numbering has become so fast in Indonesian Bhasa that I have to first think in the Indonesian Bhasa, then I have to think in English. I cannot think in Indian language. I cannot say ek, do, teen, char. It is not Indian language. First I have to say sato, dua, tika, pat, nam, nima. Tujo, laban, sapolo. Tujo, laban, samilan, sapolo. You see? That is called neuroplasticity. Once you acquire the skill, it remains with you. Once you acquire Tung Acupuncture, it will be always with you. So, the most important part of these 2 points is what? 11.09 with stomach 36. Tika bolon? Tika bolon?
36.
36. Yes. Tika nam is 36. Stomach 36. With Tika path, GB 34. And stomach 41. And near stomach 41, whatever tender points are there. The acute pain of what you call shoulder, finish. And now for knee pain. Knee pain. 11.09 with PC6, Part 7.
Sir Sastry, you forget to mention the formula of saline injection.
But Carlos, it is only for the doctors and pharmacists. Are you a pharmacist?
No, I'm a acupuncturist. Exclusively for
Then
doctors and
you
pharmacists
must
only.
have. Okay. Now the question is that you must have the license to insert injection under a doctor's care, or you can do it. So what? There's a technique. Okay. Arvind from Philippines, are you there?
Yes, sir.
Arvind
I'm
from
here,
Philippines,
sir.
are you there?
Yes, sir. I'm here, sir.
So Arvind, see, this is tough class. You have to go in the like this. Can you see my this one? And then you have to find some
No,
tender
sir.
points. Can you see my shoulder?
Yes, sir. Yes, sir.
So now this is the shoulder joint. Then you have to go in the tender area. And then in finding a tender area, this is the injection. Go inside the capsule, bend it like this, push it, and it will bend down. Bend it like this, right? And then go like this, parallel inside. And then insert saline injection, 2 ml of NS and 2 ml of DNS. So you have to take DNS, dextrose normal saline, 4 ml, insert it carefully in that area. Topic over. The frozen shoulder recovers by within 5 minutes. Along with this formula. What is the formula? Sato Sato now 11.09. No, Sato Sato Samilan. So 11.09 along with stomach Tikapolo now. Stomach GB34, gallbladder, Tikapolo path, stomach 41. Path Bolo Sato. It is 11.09 along with what? Stomach 36, GB 34, stomach 41, and tender point. So these locations you can see in Google. So those who are not familiar with these locations, you can see the locations in the Google. It is very clearly given. Write down acupoint stomach 41, you'll get the point, right? So those who are medical doctors who cannot give needles, those they can use their what? They can
Saline
use their normal
solution.
needle.
Probe,
They can
sir.
use
Probe,
their
probe, probe.
no, they can use anything to stimulate the finger joint.
Probe, sir. Probe.
Whatever they want, you can use it. I don't care. Now, this is a very important point, actually, if you see. Tung has recovered large number of patients with this one. So, if you have to combine 11.10 with 11.13, 11.10, 11.13, 11.9, 9, write down for paralysis. Herman?
Yes. For paralysis, what?
11 points. Sato Sato Samilan. Yeah, paralysis, hemiplegia. Especially in the brain infarct, MC infarct. Hemiplegia.
Yeah.
Especially spastic paralysis.
Okay.
This combination is very important. But the most difficult part of this is that you cannot give this combination every day. On the first day, you have to give the patient for 10 minutes only. The stimulation has to be given, electrostimulation by the pain which I use. Right?
Excuse me, slide again the 11.13.
1 minute. Let me complete the part. These points are very effective for treating paralysis. Generally, MCA infarct, right? Middle carotid artery infarct. This point has a direct relation with what? Motor cortex. This is the precentral gyri. Which area? Precentral gyri. Now your knowledge of NIBS will recover the patient in 5 minutes. So, Mr. Fong, you can enjoy these points. You told me how to recover paralysis patient in 3 minutes. Now there is no black magic. Dr. NG, 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 are you there? NG? All those who are interested to work with paralysis, various types of paralysis,
Yes.
you can use this. This is a miracle of.
Good. Very good.
Mm,
Well, sir.
yeah, let me think sometime. Right. 11.10. Sato Polo. Sato Sapolo. Miss 11.10. Sato Nam. 11.9. No, Sato Samilan. Yeah. Sato Sapolo. 11.10. Sato Samilan means 11.9. The location.
Guru, this is
11.10.
on 11.10.
1 minute, sir. Let me complete the point. Then the points are ahead. So first I write down the point. 11.9, 11.10, 11.30. Which are the points? 11.9, 11.10, 11.30. Now, stimulate this needle with the pin, taking the primary points as 11.10. So now, put your pin on 11.10 like this, right? And now, touch the needle like this on 11.10 and 11 point. So touch all the 4 needles like this with your finger. So all these 4 needles will get stimulated along with 11.9, 10. So primary point is 11.10, 11.9 and 11.30. So how you have to stimulate? Like this. So touch the pen like this on 11.9, 11.10 and then take the fingers and touch the needles on these 4 areas. 1, 2, 3, 4. Like this. And the patient recovers. And then predefine the muscles here now. Now, if there is a problem in the quadricep, put needle 2, then stimulate it with 11.10. Cut, tuck. Within 6 seconds, quadricep improves. Put it on 11.10 and take hamstring here. Touch your fingers with the hamstring. Wait for 5 seconds and see, hamstring is released. Abductor, all done. In how many minutes? 5 minutes or 4 minutes. And you can see a patient of infarct and paralysis recovers like. Am I clear? Or any doubt?
Ab or ad? Abductor or ad?
It's generally the muscles, all the muscles you have to classify here.
Oh,
Not
okay.
only one.
Okay.
This is what I was saying that day. when I was speaking to Arvind, they don't work directly with, when I was speaking with Filipino Arvind, what did I say? Don't go and touch the gluteus first. Because the muscle of gluteus is very sensitive to the brain. That is why I say you must learn medical science first before recovery of the patient. Taking a license cannot recover the patient. You must know the knowledge proper. So here you can see. This is 11.10. But always remember, you must have a BP machine before doing this. Why? Because the BP of the patient may shoot up. It induces adrenaline immediately. The first day it cannot be more than 10 minutes. Then after 2 days, then after 5 days. First day, then after 2 days, then after 5 days. Immediate results, immediate. But you must have proper knowledge of the muscles. And then make the patient walk, balance his walking pattern, and the needles, keep the needles inserted here. It will become immediate motor neuron programming.
Excuse me, please. The first day, we use it for 10 minutes. And then for the other day?
5 minutes.
Oh, 5.
Yes. And
Okay,
on
okay.
the, because the patient has recovered, now you don't need to stimulate it. It's a risky
Okay,
point.
thank you.
And on the third day, after the fifth day, Doc,
On
how many
the
minutes?
7 days, I think you don't need to stimulate all the points. Take 11.10 and touch the muscles, whichever are weak, stimulate it here.
Thank you.
So Arvind, can you explain me what am I said? Malaysian Arvind. Malaysian Arvind, are you there? Malaysian Arvind. Okay. Filipino Arvind, please tell me what did I speak? Filipino Arvind. Filipino? Yeah. Arvind, tell me what did I
Hello,
speak?
sir.
Yeah, tell me what did I speak?
Sir, regarding the paralysis, sir, the hemiplegia, using the 11.10 and 11.9 and 11.13.
Yes. Then?
And then on the stimulated for 10 minutes, sir.
How do you stimulate it further? Taking
The
11.10 as the primary point.
yes, sir. Corresponding on the to motor cortex, sir, on
No,
the
no, no, no.
pre-central.
No, 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 no. You made two confusions, three confusions here.
Okay, sir.
Again, please understand what am I saying. Make down the voice clear. People are shouting so much in the back. One, right, 11.10, 11.9, and 11.13. Right? Now, what to do? Take 11.10 and as a primary point, stimulate with the needle which we are using. Correct? Yes. Stimulate the needle. For how many minutes? I think not more than 2 minutes required. Stimulate the needle for 2 minutes. Earlier I said 10 minutes. It's not required 10 minutes. Stimulate the needle with a frequency of 5 or 6.
Sir, frequency of treatment.
5
See,
or 6.
frequency is not the question. Now, 5 or 6 of the pain. Frequency of the pain. Oh, you are right. I said frequency of the treatment. No. Frequency of the pain should not be more than 5 or 6. Or is bearing capacity. Sometimes the patient cannot bear. Oh, there is earthquake. 1 minute. Mummy, भूकंप आ रहा है.
Earthquake?
Yeah. In my place there is earthquake.
Bakit yung mga CSO, GA? Ha?
Wait a minute.
Yung mahapon? Binigay mo na yung sinangag? Nagutom yun kaya nangangahabol, papatayin mo yun. Kasi bakit pinakamalan yung ano na yan?
Okay now. Yes, stopped. Stopped. Okay, we can continue. Yeah, 11.10, 11.9 and 11.9, 11.10 and 11.13. Take the pain, stimulate that area. This point has direct relation with what? Motor cortex. Right? The reaction artery in the brain is MCA. Which artery it reacts? MCA. Yeah. So Arvind, I think if you can switch on your mic and stay with me for some time, I'll be grateful to you. Because sometimes these people, they get confused. I don't know what is their confusion. This Malaysian Arvind. Arvind?
Yeah, I'm here. Because my line
Yeah.
suddenly can cuts off anytime. Not very
It's
stable.
okay. So now what you have to do, see, you have to put the needle on 11.10, right?
Yeah.
And then you have to stimulate with the pain which I gave, 11.9 and 11.13. For how many minutes? 2 to 3 minutes.
Okay.
In the bearable frequency. After 3 minutes, what you are supposed to do is to map the muscles in the scalp, which I taught you. The first muscle which you will use is what? Put on the quadricep, right? Use 2 needles in the quadricep area of the pre-ear, in the parietal, in the frontal lobe. And put 2 needles, 11.10 and these 2 needles. What will happen? Immediately the power of the quadricep will start working. Then put the needle on hamstring. Then put the needle on. Put the needle, stimulate with 11.10. Arvind, can you explain them? What did I say?
You put the needle at 11.10. After that, you stimulate 2 to 3 minutes with a variable frequency, and then you place it at the muscle of the scalp. projecting to the lower limb, which is the quadricep, and then when you do that, immediately you can sense there's a movement. After that, you can place it in the hamstring and observe.
Yeah. So now the question is that when you do this, you must have the the data. The data means out of 5, what is the strength of the limb, right?
MMT.
MMT. We don't call it MMT. We call it MME. Because what is the energy used by the person is has to be taken. It is called manual muscle energy. So it's suppose the strength of the quadricep is 1. So what you have to do, take 11.10, stimulate the brain, this putting the needle here like this, correct? For how many minutes? 5 minutes. No, not 5 minutes, sorry. 10 seconds, sorry. How many seconds?
10 seconds.
Yeah, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Over. Now ask the patient to move his quadricep. You will see the power has come to what? 3. Directly you will see the change. So from 1 to 3, you will see. Or 1 to 2.5. Then again stimulate it for how many seconds? 11.10 and quadricep. Stimulate it for 6 seconds. 1, 2, 3, 4, 5, 6. Topic over. Then what will you see?
Regain of power.
Regain of power from 2.5 to 3.5. Correct? And then again you stimulate it for what? 4 seconds or 5 seconds and then recheck it. And you will see the power becomes what? 11 to 4. 1 to 4. Then taking 11.10 for other muscles. So primarily you will stimulate 11.10, 11.9 and 11.13 for 1 or 2 minutes and then projecting the muscles on the scalp. Stimulate the lower limb muscles one by one in the sequence I said. First comes the quadriceps, then comes the adductor, AD, then comes the AB, abductor, then release the calf, then hamstring, then plantar extension, dorsiflexion. Plantar extension, dorsiflexion. Correct?
Sir, needle insertion must bilateral or unilateral?
See, always in tongue acupuncture is unilateral. Contralateral, unilateral. So within 6 minutes, you can see the patient starts walking without a stick.
Sir, if the PB starts raising, I mean, you said there will be a simulation in the adrenal, so BP will increase. So at the time, 11.10 has to be withdrawn.
Yeah, evacuate all the points. Allow the patient to relax. If you see the patient is, and after inserting, please keep the patient with you for 2 to 3 hours. Don't send him home immediately. Give a placebo and put the patient with you because you have to monitor the patient for another 2 to 3 hours. His BP may shoot up within the next 2 to 3 hours.
Sir, what to do if the BP will shoot up? What point
Allow the
should be
patient
used?
to, no. Allow the patient to relax. It is just a temporary phenomena.
So, but usually for
And
high BP patients, we don't advise them to do needle. Even for me, I don't, because they might.
no. There is no. It is nothing like that. Generally, this is when we go to OT room. I insert how many needles? I insert around 300 to 400 needles. How many, Arvind?
300 to 400.
Yes. We just monitor the BP. Sometimes it shoots up, but then after 2 minutes or 3 minutes, it comes down. So allow the patient to relax. Ask the patient to take his all the medications, BP medicines, before he comes to you.
Okay.
Yeah. So if he has taken his medicines, and even then the BP shoots up, what you have to do? Calm down for 5 minutes. It's a temporary phenomena.
Ask him to
And
relax.
ask the patient to, ask him to relax. Ask
Firstly,
him to take
breathing.
deep breathing. Yeah. But the most important part is now comes the knowledge of paralysis. What is the knowledge of paralysis? It's relative. He has to follow the voice of his relative. If he follows your voice, the BP will shoot up. But if he follows the voice of his relative, the BP will not shoot up. Because he has to enjoy the treatment. He has to have a motivation to recover. The moment all these feelings are there, adrenaline will not shoot up. You understood? So
Yes, sir.
Arvind, can you explain them? Explain them. What did I say? Arvind, can you explain them? Arvind, can you explain them? I'm very much afraid what you will do. I do not know. See, I don't take any responsibility for your clinical wrongness because I do not know how much you are trained. My duty is to teach you. I cannot take the responsibility of your mistake because you are not trained at all in paralysis. You are not trained at all in anything. You have not attended this class also carefully. So I don't take any responsibility for this. Am I clear?
Yes.
Clear.
Yes.
Walid Mukarim, am I clear? Walid, are you
You're
there?
loud and clear, sir. And I have it on record
I,
that you have said so, sir.
you have it on record that I
Yes,
don't
you have
take
said
any
so.
clinical responsibility for their treatment because they are not properly trained. But then you asked me to teach you. So I taught you one of the critical treatment to recover paralysis in 4 minutes.
Inshallah, sir. Inshallah, like you
How
are
many
proud of
minutes?
Dr. Mr. Fong, we're going to be proud of all of us, sir. No cause for alarm.
Within 4 minutes.
Yes.
And that is why I say you people that please do your course systematically, please bring more students, please bring more people, do some advertisement, bring good people and form a good group so that when you do your MSc, you become one.
Yes, sir.
Because you have to reduce the cost of your studies. I am ready, but if you are ready, then it will not help. You have to publish your paper. For publishing a paper, the journal takes more than 300 to 400 US dollar. So now if you are 4 people, you have to pay only 100 US dollar. But if you are alone, you have to pay $500 to one person, 500 to the one who will help you to format the paper. So you have to pay $1,000. But if you are 5 people, you pay how much? 200,
Yes.
100. So always try to understand one thing. You must work with scopus intermediate. And this is why I'm training you.
A robot guy.
So am I clear to everyone?
Yes, sir.
Yes, I understand.
Yes, sir.
Yes, sir.
Sir.
So by using this formula, how many minutes you can clear paralysis?
About 4.
10 seconds, sir.
4 minutes.
10 minutes.
4 minutes.
2 plus 2, 4.
4 minutes. 4 minutes.
Yeah, 4 minutes of stimulation, patient recovers by 70 to 80%.
Or any type can be recovered?
That is why, huh?
Any type of paralysis. This can be
Then, did I say any type of paralysis can recover?
only hemiplegia.
No, it is for MCA.
How can you recover any type of paralysis? Is it a magic? That is why I say we are very much afraid of teaching. If you write this and that and you treat something wrong, what will happen to the patient? Be careful. I again announce, Walid, Mickey and others, please hear carefully. I take no responsibility for the clinical default. Am I clear?
Yes,
You are clear, sir.
you are clear.
Loud and clear, sir. And they all understand that, sir.
Because the question is that the person who said any type, all types of paralysis, imagine, how can you clear all types of paralysis with this system? Not possible. When I say MCA infarct, MCA supplies to which area of the brain? Motor cortex, sensory cortex. It is the frontal and the parietal lobe and the hearing area. So you have to be very careful. That is why I say, please train yourself properly. Don't eat a half-cooked rice. I don't know what will you do with the patient.
Sir, what are the contraindications of this technique and what to do?
See, I already explained you. The contradiction is nothing. The patient BP has to be managed. I taught everything in the class. I said whenever you take anything, you have to take the support of the attendant. You have to take the attendant of the patient with your support. You cannot say the patient, please move your limb, please do this, please do that. You cannot tell the patient like this. It is the attendant of the patient who has to do it. If you do this and that command, if you say the patient, you move your limb, and if the attendant of the patient who is close to the patient, if she is not there, what will happen? The case is finished.
Assalamu alaikum, Mama.
Yes, tell me.
Mama. It is me that is sorry. I was supposed to call you yesterday. Miki Ta'azia online, say Namanta. I don't know why she lost her uncle. Janupa Lapia.
See, if you add ECP and all these things are not required here. I don't know what is ECP. Sunil BSK, what does it ECP means?
It is electroencephalogram, sir. Or electrocardio.
Oh, ECG.
No, one is EECP, sir, in some terms. One other is electroconductive protocols, sir.
It is given to heart patients. ECP is a machine which gives the electronic counter
Oh,
pulsation.
I understand this machine, which was
Yeah.
banned by Supreme Court. Yeah, that machine.
So
Which
it
they
gives,
use for this cardiac
yeah,
purpose. It was banned. Yeah, it was
Counter
banned
pulsations.
later on by Supreme Court of India.
yeah, it's
Yeah,
a
counter
counter pulsation.
pulsation. No.
Counter pulsation.
No. See, all this EECP and all this not advise anything here. The procedure is very, very simple. Don't confuse and add your spices. Don't use garam masala in Filipino dish. It will destroy that taste.
That improves the collateral circulation. That's all.
No. You cannot use all this here. It's a very simple treatment. Paralysis is a simple treatment. Don't haphazard the brain. Am I clear?
Only this will help for heart, sir, not for paralysis.
No. I know that ECP machine I have seen in Malaysia with
Whole
my
body,
brother.
whole circulation. It
I have
improves.
seen. It improves, but then we don't need it. Our work is finished with these 5 needles. The total number of needles you use is 4, 5, 6, 7, 8, 9, 10. 10 needles is enough to recover a paralysis patient in 4 minutes. If you do this procedure correctly, write down. If you do the procedure correctly, within 4 to 5 minutes, the patient is stable. How many minutes?
4 to 5 minutes.
Yeah, patient recovers. MCA infarct. Topic over. Now, write for cervical radiculopathy. C5, C6, C6, C7. Acute pain, what will you do? Acha, how many of you can reduce Arvind, can I ask you one question? Now let me take one medical doctor from Malaysia. Any medical doctor from Malaysia would like to talk to me? Any medical doctor from Malaysia? Any medical doctor from Malaysia would like to talk to me? Excuse me? Any Malaysian doctor would like to talk to me? Dr. Ling, can you like to talk to me? Will you like to talk to me? Dr. Ling? Dr. Ling, will you like to talk to me?
Yes. Hello.
Yeah, I'm so sorry I disturbed you. I have a question
It's okay.
to answer this question.
Yes.
If the person is having acute cervical radiculopathy radiating in the medial and the ulnar nerve, and the pain is 10 by 10, and he is wearing a cervical collar also, at that moment, what kind of treatment will you advise him?
Because I'm not very familiar with acupuncture.
No, no, let us not come to acupuncture.
Oh.
Anything else?
I use a painkiller.
Sir, in how many minutes the painkiller will subside the pain?
Oh,
which kind of painkiller will you use? Which kind of painkiller? Which will be your first choice? Which will be your first choice?
The cheapest is Wateran, injection Wateran.
Okay. It is diclofenac sodium chloride?
Yeah, that's right.
Yeah.
It will take about 10 to 20 minutes.
We'll be using
to decrease the pain.
Even sometimes it does not do it, sir, in cervical radiculopathy, because the pain is too high. The painkillers do not respond it. But now, if if I give you 4 points, 3 points,
yes,
3 plus 2, 5, and the pain will immediately subside in 10 or 20 seconds, what will you say me?
That's why I come to learn from you.
So, sir, please write down the point. 11.11, Sato Sato, Sato Sato. 11.11 and 77 point. $77.26. Dr. Ling, can you hear me? 77.26. Immediately pain, what you do?
Sir, can you repeat again? Your voice cracking.
Okay, write down 11.11. Yes. Along with 77.26. $77.26. Tujuh tujuh dua enam. Dua puluh enam. Tujuh tujuh 26. I like my Indonesian bhasa very much because my brother taught me very nicely. I really enjoy this. Tujuh tujuh 26. Now what will you do, Dr. Ling? Can you see me, Dr. Ling? Dr. Ling, can you see me?
Yes, I can see you. I can see you.
This is the, now this is the disc. You have to palpitate. First you see the X-ray, then see which disc lesion is there, right?
Yes.
Once you identify the disc lesion, do you have one thick color pain, what you call black marker. Do you see that black marker, the thicker one?
Where?
So mark the disc. The centimeter of the disc will be around 2 to 3 centimeter.
Oh, I don't have the one.
Yeah, in between the vertebrae. Correct?
Between?
In between the vertebra, 2 vertebra, there is a disc.
Oh, in between. By the
So the size of the
the back.
Yeah.
Mm.
Yeah, on the back cervical vertebra. So if you see, this is C5, this is C6, right? And in between the C5 C6 a disc.
Yes.
Can you see?
Yeah, I can see.
Yeah.
I
Now
can see.
this is the disc. This is the disc. Right?
Yes. Yes.
The what is the size of the disc?
So
2
this
to 3 centimeter.
2 centimeter. Okay.
Yeah. And this is the length.
Length of the dish.
Yeah. This is the length. So the length of the disc is also 2 to 3 centimeter. Correct? The length. So mark it with the pain. What will you do? You will mark it with the pain. Then take normal saline 60% and 40% dextrose saline D5. Did you understand, Dr. Ling? What did I say?
Yes, I know. About how many cc? How much?
2 ml. You
2
have to
ml
take just 2 ml. Yes.
2 ml each. Okay.
No, not 2 ml each. Now you can see this is the top, this is bottom, this is the bottom, this is the top, right? 4 direction of the disc. Top, bottom, top,
bottom.
Correct?
Correct.
Now bend the needle like this. See? You have a 2 ml syringe, 20 needle. You bend it like this. This is a needle. You take the help of the body and you bend it like this. Correct?
Correct. Correct.
And now insert it like this. This much.
About 1 centimeter.
Yeah, around 1 centimeter. 1.5 centimeter, like this. Correct? And then give 0.5 ml.
0.5 ml to each place.
Yeah, to each space. So it will go 1 ml, right?
That's right.
Now use, then take 1 shot again for 1 ml. So it will become 2 ml again. Take another 2 ml. And then see where are the tender points in this area. Ashi points. Insert, topic over. The patient recovers. He will not come next day with so much pain. But then you have to ask him to use the cervical pillow. Immobilize the neck. Topic over.
Okay, thank you.
Now tell me, what is the cost of your injection and what is the cost of my treatment?
Your treatment
is higher.
Definitely my injection is higher.
What is the cost of your injection and the disposal?
I think also not much, about 5 ringgit.
And what is the cost of my treatment?
I think about 20 cents. 20 cents. About 20 cents. 20 to 50 cents. I think 20 cents enough. You can normal saline and the extra fine.
Dexter fine, right? Only 4 ml. One disposable syringe and 4 needles, 3 plus 2, 5 needles. That's it.
So 1 ringgit.
Dr. Ling, can you hear me?
Yes, I can hear from you.
What side effect do you think that treatment has?
Which one?
My treatment.
And definitely your one is having the speed, direct to the point. I think more effective.
No, what is the side effect do you think this treatment have?
Oh,
No side effect.
No side effect.
See? Now use 11.10 and 11.12. No, 11.11 and 11.12. For what? Cervical and lumbar pain immediately to recover. 4 points. 11.11, 11.12. 2. Topic over. But then go to the local, first see the X-ray, go to the local area. And now one more method I will teach you, Dr. Ling. Can you see me, doctor?
Yes, I can see you.
Only for the medical doctors and those who can give injections. Can you see my cursor?
Which one? I cannot see.
Cursor, white color cursor. Can you see in the screen?
Because I can see. I can see.
Yes.
Can see on the line.
Yeah. So this is the L4 vertebra, right? So now there is acute pain. The patient is having radiculopathy, right?
Yes.
The pain SLRT is 20 degree. The pain is how much? 10 by 10. What to do? What? Yeah. Patient is unable to walk. What will you do? What is your procedure to recover the patient?
Now I can try to use your methods.
No, not my method. You forget MK Sastry. What is the medical treatment?
I can do the same thing. If acute pain, I use IM, Voltaren.
Yeah. How much minute he will recover?
We take about 10 minutes, 10 to 15
No,
minutes.
sir. In extreme pain, I am sorry. My experience is more than 2 hours it takes to recover the pain by 30%.
Oh.
When the disc is extruded, when the canal stenosis is there, how much time you take to recover the pain?
I think it's about 1 minute.
2 hours. In
2
that
hours.
procedure, and in my procedure, only 2 to 5 minutes.
Yeah, that's why I said the office procedure.
My procedures are very simple procedures, easy procedure, and no side effect if properly done. I don't take the responsibility of anyone because I don't know what they are trained, right? So what you are supposed to use, you're not supposed to use the 11.10. So the 11.10 is here, right? In the upper phalanx. Now 11.12 is in the middle one. So 1, 2, 3, 4. 4 needles you have put up, correct? Now, do you know how to use the spinal needle?
Yeah, I know.
So which number spinal needle do you use?
Spinal needle.
Yeah.
I mean the size.
Which number? The size. What is the size you are using?
I use a small size about.
Yeah, it's actually, we generally use 23 number. Which number?
23.
Yeah, right. 23. So what you are going to do? This is the vertebra, right?
Yes, correct.
There are 2 ways you can recover the patient. So now put 1 finger here. Correct?
Correct.
Adjacent to it, put 2 more fingers. So it will come here. Parallel to the disc. Correct?
That's right.
Now insert this spinal needle up to how much centimeter? I think you can insert the needle up to
1 centimeter.
No, half of the needle.
Half the needle. Half the needle very deep.
Yeah, half of the needle deep. Parallel. And then insert how much ml?
By 1 ml.
No, sorry, it will be around 10 ml.
Which one? The normal saline.
Dextrose. Dextrose.
Normal saline.
Dextrose. Dextrose 60%. Dextrose 5. Dextrose will be 60%, and normal saline 40%.
40%. 10 cc.
Yeah, 10 ml, 60-40. Generally, you can use 5 ml, but generally we use it 10 ml. So you put one thing at upper location, you put 5 ml, and then dust come down 2 finger down, and again you insert 5 ml. Correct?
Wow, this is quite a lot. Too much.
No, dextrose saline will not harm. We used to insert 20 ml, no problem. And then come to the opposite side. You put 5 ml this side, 5 ml down. So total 5, 5, 5, 5. How much? 10 ml.
10 ml.
20 ml.
5, 5.
Total how much?
20.
5. We are 20 ml. Okay. And then second procedure, Dr. Ling, you can see this.
Yes.
Taking one big, this 23 number needle, you can insert the needle from here.
Yeah.
Here. But then you have to go like this, you see, like this. From here to here. You have to bring near the vertebra. Insert this needle, what you call spinal needle from here. By the psoas. Come into here. Vertebra. And then insert around 10 ml.
It's on the muscle.
Yeah, not like this. Not inside. You have to go like this. Parallel to the vertebra, like this. You have to touch the vertebra like this. Not like this. Like this.
Parallel.
Yeah, parallel. You have to go like this. Right?
Right side. For the side.
The moment, and then the moment you touch it, just insert 10 ml. This side, 10 ml. That 10 ml one side also is enough in this direction. The patient, then you will see the area is bulged out like this, right? The saline is bulged out like this. So press it like this with the hands. Yeah, press it. Patient will recover.
Okay.
Immediate recovery. But then patient has to go for bed rest for how many days? 21 days, no movement. This is equivalent to, I say this, equivalent to the nerve block which we give. The cost of the nerve block is how much? If you go for the nerve block, it is how much money you have to pay. You have to pay around how many ringgits? Around 7,000 ringgits to 8,000 ringgits for nerve block. Here, what is the cost of the ringgit? Malaysian ringgit. It will be how much? One spinal needle, how much? Dr. Ling, one spinal needle, how much?
About 5 ringgit.
No, it is not 5 ringgit. It is 23 ringgits.
No, they're expensive.
The needle, spinal needle cost you around 23 to 24 ringgits in Malaysia.
Because it can be reused.
Oh, I don't know, because what we buy, we use is 23 ringgits. MRP is 23 ringgits. I don't know what is the wholesale price. And then we use the 5 ml, this. The cost is around 27 ringgits. But if you, on the other way, if you give a nerve block, the cost is around 1200 ringgit. So it is around 40 to 50,000 rupees or 40,000 rupees in Indian currency. Even in India, they charge for nerve block is around 30 to 40,000. And this procedure is only less than 400 rupees. Indian currency.
That's very cheap.
Yes.
So, saline clears the nerve blockage in the.
Yeah, it acts as we are not calling it nerve block.
Okay.
But then it is very, very good.
Effective.
Very, very effective. Provided you are a medical doctor, you must use it. If you are not a medical doctor, don't touch all this type of techniques.
Yes.
Because if the patient, sometimes when you see the needles and injections, the patient will go in the stage of shock.
Yes.
Psychological shock. We call it vasovagal syncope.
Okay.
The pain subsides down. Means the BP will fall down. So what will you do? It is not for your treatment. It is because of the psychological level of the patient.
Yeah.
So it is called as vasovagal syncope.
Okay.
So you have to be careful with this. So now, these 2 points is very good for tachycardia. 11.13. Prick it, put heart 6, PC 6, heart 7, PC 6, lung 5. Use 11.13. So we'll complete the 11 zone today itself, right? 11.13 with PC 6, heart 7. Immediate recovery in what? Palpitation, tachycardia. You have to bleed it. So how will you bleed? You know what is the glucometer sensor? What lancets? You know? Lancets?
Yes.
So put the lancet here and bleed it. Don't use all nonsense what you are doing. And never use this 3 gauge needle, 4 gauge needle. All these are horrible. Gone are those days.
Which point to be bleeded?
11.13.
Yes, thank you.
So this point is very good for what?
Facial paralysis.
Yes. But then you have to use some local areas. So I'll not advise you immediately how to use 11.14, but then you can write down one note. Alone 11.14 will not help the facial palsy. But it helps you to recover the facial nerve. 11.14 along with the bleeding of 11.13. Bleed 11.13 and add 11.14 and the local stimulation. Patient get faster recovery. And sometimes you can recover facial palsy in how many minutes? Arvind, Malaysian Arvind, are you there? Malaysia? Malaysia, are you there? Dr. Ling, may I ask you one more question?
Yes, yes.
How many days can you recover a facial palsy case like this?
Oh, no, definite. Sometimes take a few months. Then I cannot recover.
And if I teach you to recover in just 2 minutes, what will you give me?
As much as you like.
I think you can give me a good hug.
Yeah.
You can give me a good hug for teaching you how to recover facial palsy
Yes.
with 4 needles. 3 needles in the fingers.
Oh.
3 needles on the face area and 2-3 in the scalp. And recovery time 3 minutes.
So that's very fast.
Now you tell me, conservative treatment is fast or this treatment is fast?
Of course, this treatment is fast, very fast.
And what is the after 3 minutes, if you get 60% recovery, which treatment will you recommend? You will recommend medicines or will you recommend this treatment?
Oh, of course, this one no side effect.
And you get results in how many minutes?
I think in 1 to 2 minutes.
Yeah, 2 to 3 minutes.
Ah.
And in your medical science, how much subject time we will take? Now medical science.
But that take a long time. It may not recover also.
So which is better?
Of course, this one.
And it may not recover also.
It may not recover, definitely.
So what will you say? How much, which is better?
Of course, this one is better. But this one not easy to learn.
Why? So easy. These 3 points you put. 1, 2, 3. Some facial points.
These
2,
3 I
3
know.
on the scalp. Then use my pen to stimulate, which I will show you. Krr, 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 krr. Topic over.
Yeah. Use Acupen.
Acupen, right. And now if you can recover this patient in 2 minutes, what will you say? Which is better?
Of course, this is better.
So my advice to you is, Dr. Ling, please develop a one wellness clinic. You're doing a conservative practice. Also, parallel to it, take one clinic and make it a wellness clinic.
In case I can.
So whatever patients you have of typical cases, keep 1 or 2 physiotherapists in that clinic, right?
Yes.
So do the primary treatment of dry needles and all in that clinic. And then put ask them to do some physiotherapy. After how many days you will get the result? You will get the same day results. Lot of people will be benefited by your treatment.
But this one need to repeat how long? How many days once?
Share 2 or 3 days is enough.
Oh.
But then it depends on case to case. Generally, some cases they recover 70 to 80% in 2 sittings. And some takes 14 to 15 sittings, 13 to 14 sittings.
Oh.
Because the problem is the blow of the air. If the face becomes okay, but this area, you can see this one. This area becomes very difficult. This is the last part. So when you blow the air, it comes out from here. Leaks out here. So this area is difficult to repair. Otherwise, the maximum recovery can be done in how many minutes? It can be done in
2-3 weeks.
3 to 4 minutes work. But then you have to make the muscles trained for physiotherapy. So keep one physiotherapist in your clinic, part-time physiotherapist. Treat the patients in your wellness clinic. It will be a good business for you also and recovery of the patient also.
Treatment should be once in 3 days, sir?
It depends on case to case. But generally, I always touch the patient only once or twice. And my patients are referred to my physiotherapist and then they do something, and the patient is enough.
Okay.
In my whole career, I see the patient only once or twice, not more than that.
Okay.
And you know how much time I give to one patient for recovery? 2 to 3 minutes or 4 minutes maximum. Only in the OT room, I give him maximum time. Otherwise, my maximum time to one patient is how much? 3 minutes or 2 minutes.
Okay.
And I never use this Tung acupuncture or this. I always use my own methods. Tung, I have forgotten. I only like Tung because of my Indonesian family.
Okay.
Otherwise, Tung, I forgot. I never use because according to me, Tung is obsolete. It's for newcomers, not for senior practitioners. So, this 11.15, very good for what? In
sir, kidney.
Kidney deficiency, not kidney disease, CKD. In TCM, Chinese medicine, it is said because of the kidney weakness, you have this pain. So write down the points. Lingo Dabai 11.15, SI3, A.04, A.05. Lingo Dabai 11.15, A.04, A.05, SI3. Topic over. No need to stimulate, just insert the needle. Leave it for 45 minutes and do something like that. Manipulate it. Lingo Dabai is 22.2. I will show you the Lingo Dabai points. So write down Lingo Dabai. Lingo Dabai 11.15.
For
11.15 tiga A 0.4, A 0.5 and Jong Bai. Jong Bai. It is here. See? Yes. This is A.04 and this is Jong Bai. A.05, sorry. Yeah. I used 1 minute. I forgot. Long time I did not use. 2, 3, 4. Yeah. A.04. Yeah.
22.06.
No,
Tong Bai.
22.06. Yeah, 22.06 and this one. A.04
Yes.
5. This needle and here. And SI3 here.
That is approximately near to TW.
Sir, what is the issue point in small intestine, please?
Huh?
What is the point in small intestine, SI?
You can use this one for your back pain. 11.15.
And then
SI3.
Lingo. Yeah, Lingo Dabai. SI3. A.05. I think it's A.05 or 04. I don't remember. A.04 and Chongbai. Write down the points. Go to Google and see it. Write down Tung point A.04. See it. I forgot because I don't use it anymore. I have not practiced Tung for how many years, you know? More than 5 to 6 years because it's outdated.
The Tong Bai is used for kidney deficiency.
So today we'll complete.
22.06.
It is 22.06. Write down the point number 22.06. Okay? You may ask me your questions now.
Sir, these points can be used for bilateral treatment or
No,
unilateral.
ever use. No. In Tung acupuncture, the principle is bilateral is forbidden. Bilateral is what? Forbidden. That is why I always say you people that always go for a proper coursework so that you don't make any mistake in your practice.
Oi, Tung acupuncture always opposite side, isn't it?
Yeah, contralateral, right.
Contralateral, isn't
Oh,
it?
I will. Oh, my brother, I was calling you many
Yeah,
times.
right.
You did not hear my voice. You did not hear me.
My Wi-Fi here very bad. Suddenly can see on and off. Today very bad.
Today, if you use SNIT with this, the patient recovers like tuck, tuck, tuck. Within 3 tuck, the patient recovers. Within 2 minutes, 3 minutes, the recovery is very excellent in 80% of the patient. See, Sobha, it all depends on what you have created inside the body. It is not possible that you can put some point here and this can be recovered with 2 minutes, 3 minutes. So all these things will. This is the point. 11 point. What was the last point I gave you? 11 point.
15.
15.
Huh?
15.
So write down. Some question asked me what is the point. Write down 11.15 along with A.0. I think 5.
04 and 05.
Yeah, 11.05 is 11.05. 22.06. It is here. You can see this point. I don't know what is this. We call it Bafang. In TCM, it is called as Bafang. This one. And then here. And then 1 year, SI3. Actually, for a long time, I have not used Tung point, TCM points. Very difficult for me to remember. I don't use anything like this. I work with the nerve and the brain and this central circus, poetry central gyri. So I forgot all this Tung point, 10 point, balance method. I all forgot. Only to teach you, I am revising it. Because according to me, it is outdated. But for beginners, it is very good. It will motivate you to practice in the clinic.
Sir, even Tan's method is outdated, sir?
200%, it is totally outdated.
Okay.
For last 8 years, I did not practice 10. And even I don't teach. My juniors, they teach it. If you ask me to teach 10 methods, I just feel that, oh God, I complete 10 balance method in just 5 minutes. Totally outdated method. If anyone practice in India or this methods, then I say, oh, this person is totally outdated. Tell me.
Yeah, what should be the approach, sir? I mean, what should we?
See, always the approach should be based on the disease-based approach. You must know the dermatomes, myotomes. You must know this. You must know this. That is why I say you must go by a proper course module. You must know about the nutritional medicines. You must know the pathophysiology of the disease. You must know the grading of the disease. How much disc is compressing the nerves. All these things you must know. You must know how to use the X-rays. You must know how to understand the X-rays. You must know all these things.
So MSc course will be having all these things, right?
Definitely, we have already preparing the syllabus that all these things. Definitely, you have to go for a good course. You need to attend many doctors.
Yeah.
That is why I say you should come in a group of 4 to 5 people. But then you have to take your own interest. You have to create your own group. Because I am not too much involved. The question is that the application form is given by the Lincoln. Pay money to the Lincoln or the society involved. And then get done the classes. Put the topic over and stop. Bye bye, tata, see you. Go home and sleep. See, we as physicians, what do we say? I always say to people that if you don't take effort, you cannot work with that problem. Because the course fee in any medical course is how much? If you see, in India, it is this type of courses are not less than how much money? 30 to 40 lakh rupees. And how much we are trying to bring it? We are bringing it to 1.5 lakh rupees. It is only possible when we have 100 students per course. Because you have to involve lot of professors, doctors from different field. So what you are using is Melody. It's a Chinese one or the my one?
Acupuncture needle, sir. Acupuncture electronics device.
No. Whose pen you are using? It is Chinese or my one?
Chinese also, sir. But
Don't use this one. Don't use this one. It will destroy the points.
Okay. Sir,
Never use this pen. Never use it, because the question is that this this pen, when they are manufactured in China, they don't have a quality control system. They make it by the labels and they don't qualify it. If you see all the pens, they don't qualify Chinese acupuncture system. These are something what they want to make. They just see that the people enjoy the pulse. They copy our designs. They make it without knowledge of the machine. Every pen after making should be checked on the CRO. Walid, can you tell them what is CRO? Walid Mukarim?
Yes, sir. Yes, sir. I'm here, sir.
What is CRO? What is CRO?
Cathode ray oscilloscope.
Yes. What does it mean? Tell them.
A cathode ray oscilloscope is used to check frequencies and pulses. It is used to monitor the electronics that you cannot see, electricity, so to speak, frequencies, pulses, basically to check circuits like that.
Yeah. So now the question is that when you check this type of circuits, you'll find that they don't have the system of is not incompatible with the brain. That is why I say, whatever you people are doing, you spoil the patient, you spoil the case because you do not know what you are doing. You did the same mistake what we did 2000 years back. You took Jesus Christ as a criminal and you murdered him. Similarly, you took this pulse machine, something which similar to this. You put the pulse, you know how it reacts with the brain and the reaction area, reaction nerve. You know nothing. You put it, you get some relief, it's good. But you don't know the mechanism of reaction inside the body and you destroy it. How to use it, how to hold it, how to catch it. All this is a mechanism. People just do whatever they like. And that is why I say, thank God, I'm not your patient. Any more questions? Question, please.
So what are the points for knee pain?
We'll come across lot of points. There are a lot of points. There will be 2000 protocols in this. Yeah, you may leave, no problem. More question, please.
Sir, can you please repeat the points for paralysis, because I lost my connection.
You have to ask from that. I will give you the notes. You write down because I don't remember.
All right. Okay, sir. Thank you.
More questions, please. More questions, please. More questions, please. Now I want to ask, where is my favorite boys? Harman. Harman.
Yes, yes, I'm here.
Now tell me, what do you mean by reaction nerve, reaction area, reaction organ area?
Reaction nerve. The nerve react to the stimulation.
What is a reaction nerve meaning?
Am I right? The nerve react to the stimulation. Give response, I mean.
Better you give me one Cadbury chocolate, okay? Sometimes I lose my temper. If I eat the chocolate, my mind will always remain cool, okay? Hmm. Correct, Haman?
Yeah, yes.
So whenever you come to my class, bring some Cadbury chocolates, okay?
Okay.
You know why?
Yeah, don't know.
Because after teaching so many things, when you are not attentive in the class, what will happen? You don't understand what I told. What do you mean by reaction nerve? You must know what it means. It's the important part of the subject. I told you you know, when did I teach you this? When you were sitting next to me, when these classes were carried on. In Malaysia also I taught you, what do you mean by reaction nerve? But then you people don't put in attention to what I say. You should put, no problem. I'll tell again. Write down. So, Arvind, can you tell me what is the meaning of Filipino Arvind? Can you tell me what is the reaction nerve? Filipino? Filipino, are you there? Arvind? Arvind, are you there? Philippine Arvind, are you there? The reaction nerve means when you insert a needle here, it goes stimulation here, and then it gives signal to the nerve over sciatica or this nerve or the other nerve, whichever it is associated. The primary nerve stimulates the certain nerve. The stimulating nerve is called what? This is the action nerve. The reaction is in some other area. The reaction area is called what? So there are two things. One is the reaction nerve, one is the reaction organ. So that part you have to understand, that when you insert the needle, which is the reaction organ, which is the reaction area. And how fast the patient can recover? He can recover in just 2 minutes. How many minutes? Less than?
2 minutes.
2 minutes.
But then this is all outdated. You must practice it. It is very good for initial practice, but then the patient not recovers, it leaves. If you don't follow the other procedures, I gave you the principles in the beginning of the class. But then most of the people did not write the notes, they did not understand the things, and that is why you could not recover the patients. The most important part is that you must know the procedure to recover the patient. That is why when I was teaching the pathologies of the disease in the first semester, first diploma, today this knowledge would have been helpful. But then how many of the people only attended one diploma, they did not come here. Now those who attended this, They do not come to the first one. What will happen? The knowledge is spoiled. So those who were from the very beginning, like Mr. Fong and all, their knowledge is very good now. Their concepts are very good. You don't need any person to convince anything. They are ready to convince anything. A person came to him for stem cell and he said, oh, stem cell is very costly. You go for NIPS, it is better than stem cell. And he proved him, he explained him. So that's what you have to see. Anyway, thank you so much, Dr. Ling. I'm very much obliged to you, Dr. Fong, and all my friends. Thank you so much for your kindness. I never thought who would like to hear this old man. But then I'm happy. Some old people are still ready to hear me.
I'm here, you, sir.
We are.
Here I am.
That is why I say, some old people are still ready to hear me.
Yes, sir. And you are still inviting
I hear
others
you,
to hear you.
But then it is my humble advice to you. See, you have to work from right now. You have to gather your people. You have to prepare for a proper coursework. You won't find us. Because see, the question is that if the coursework, if the fees are high, you cannot attend the course. So you have to work in Nigeria, you have to work in Malaysia, you have to work with everyone. So my humble request to all of you is that please try to advertise this course. Bring good people. Don't bring nonsense. You cannot preach nonsense people. Bring good people. Make a group of 4 or 5 people. Apply in the university. Because you need to publish your papers. Always remember, I always advise you, try to write papers. I'll help you to do many things. Whenever you write Tung Acupuncture, you must be able to see what you have done in your clinic and then put up these data. You don't need to do anything. And once you are qualified, when you publish your papers, no one can question your knowledge. The most important part is that no one can question your knowledge. Now it's up to you. You want your knowledge to be questioned or you want to have a respected life in the society for another 30 years or whatever you do. I'm very happy that people like Ahmadi, who is a construction worker, is going to prove the society to be wrong. That he can publish his papers. And I'm sure me and Ahmadi will jointly publish papers. 2, 3 papers we are going to jointly publish. And then we want to say his children's. At least I'll be happy that your father is still better than you. Because his children do not have any publications in international journals. And that will be my finest recognition to my nephews. That, see, my nephews, you people could not publish any paper internationally, and your father and me has international publications today. So still we can say to your children, we are your father and I'm your uncle. Tell me why? Because you people don't have publications and we have publications. Yes or not, Amadi?
Thank you.
I know
you are right.
we know medical science more than them, right? At this age also I can qualify MSc. At this age also Amadi says I'm better than my children's. And that is why I say Ahmadi is still the father of the children, not the children are his father. At least whenever there is a sickness in his family, whenever there is a disease in his family, he can understand the doctor is giving a right treatment or the wrong treatment.
Yes, thank you very much.
For what? Temakasi, why are you saying Temakasi? For what do you say me thank you? It's all our joint responsibility. And still, I am very eagerly waiting for that day when I will say, your children, oi, come. See, your father has published your paper. How many papers can you publish? That day, I'll be happy that you have a Scopus Index publication. It is not a normal journal. It is called Scopus Index Publications.
Thank you very much.
And that we also try. Once we start having 1 or 2 papers published, You know the pattern. Then every day you will write to what? Every year you will try to publish how many papers? 3, 4, 5 papers. So before you die, you will publish how many papers? 30, 40 papers, 20 papers. Then we will say, oi nephew, come. How many papers publication you have? Sir, no. What is paper publication? You will ask me. Oh, you don't know that? Ask your father. He's having 20. See, dream for a big, have a vision for your life. And I'm very sure one day Amadi and some good people will complete his PhD, especially Mr. Fong. And then I'll be happy that I'll take these few people along with me to Oxford University and to uh, Stanford or Harvard, so that these two people also can complete postdoctoral along with me from two reputed universities of the world. So that is what I say. Those who want to go to Harvard, those who want to go to Stanford, start preparing yourself from today. Bring your good friends, make a group so that the cost of your education becomes very less. My target to bring the cost of education is in 2 years only 4,000 Singaporean dollars. Means 1 year only 2,000 Singaporean dollars. 2,000. And we want to prove the world that the age is not the limitations. After the retirement, you should think of studies and then you can excel it.
Sir, clarification.
Yes, what clarification, Cindy?
Good evening, sir. Good morning. That paper that you mentioned, will it be for the MSc course?
Yeah, see, one thing I tell you. Today, things are not like what we were working in our days. Now, there are agencies who are helping us to format the paper. There are agencies who are there to send our papers in the correct journal. But to publish a paper, you need $300 in the journal. You have to pay them how many? $300 to $400, right? And then for correction of the papers, you have to pay how many? $400. So you need $800. But if you go alone, you have to pay 800. But if you are in the group of 4, how much did you pay?
Maybe
200. Yeah. So how many pesos?
200.
10,000 more or less.
No, less than 10,000, madam. It's around 8 to 9,000 pesos.
How much is the dollar rate now? If it's 50.
How much?
9,600.
Huh?
Okay.
9,600.
Yes, near about this. So now you can see by spending only 9,600 per person, you are having what? You are having a Scopus Index publication. Now you tell me, how many of the Filipinos have published papers in the journals? Who knows you? Where is your level of work? So always I say, when you work, publish your papers, write your papers, then your mind will open.
So,
Then you will understand what is right, what is wrong.
So can we choose the title now and have your approval for it?
No, it will not help you, because when you go to a MSc course, you will go through various of topics. You will meet many professors, many doctors.
Okay.
Then you select your topic. The selection of topic comes only after 1 year of your education.
Okay, I got it. Thank
See,
you,
now
sir.
your knowledge. See, now your knowledge is what? Now your mind is opening. After taking, I have spent 600 lectures, 600 hours. Even if you ask them these questions, some of the people, you see, their knowledge is still what? They are speaking about what? 20 years back. Our students have not understood even 10% of 500 hours which I taught them. Because of the questions when I ask them, the questions they ask me, I understand their knowledge is still very inferior. So when it becomes superior, when you attend the course, when you submit your assignments, when you appear the MCQs, then your mind will open. Because right now, you don't have any examinations, you don't have any test. So what do? You just come here, you enjoy the party and you go home. I always tell my class as a party time. People tell me, what do you do? Oh, I am in the party. Because the quality is not generated in the way you are working. Because I see all are very slow. Now you tell me, we have to increase our membership to how much? 500 people. How many of you are trying? How many of you are bringing? You know why? Because it will reduce the cost. You have to take 200 people. 100 people will come from the open market. So we have to work totally with a proper way. If you work properly, if you work nicely, your cost of education will come to how much? It will come to how much? You can say 120,000 or 30,000 pesos. Total cost of education. But if you see in Philippines, how much you have to pay for this quality of education, for meeting so many professors, you have to pay not less than 500 to 10,000 pesos. Medical course is very costly, madam, or 20,000 pesos. In America, this type of courses are very, very costly. They charge you around 50,000 pesos, $50,000. Even in India, it is very costly. We are trying to reduce the cost. Why? So that it becomes affordable for everyone. And then installment system. For 6 months you pay. Then after 6 months you pay. On the first month you paid for 6 months. Then you collect some money, 5,000 pesos, 5,000 pesos, 5,000 pesos. Then you pay for the another 6 months. So now the cost of education has become very affordable. But in Singapore, I can say you pay $600 Singaporean dollar for 6 months, then another 600 to $1,000 for the another month, 6 months, then third month, then fourth one. So it becomes affordable for everyone. I'll ask Mr. Fong, can you afford $600 Singaporean dollars for 6 months of education? 1,200 for 1 year? How much costly it is?
Yeah, it's quite cheap. Quite cheap.
$2,000, sorry, $2,000 for 1 year is how much? Is it cheap or is very costly?
In a way, some people cannot afford. Yeah, so
Then
depends.
see, well, one thing I tell you, Mr. Fong, those who cannot afford, they cannot study in the college also, university also. Because in India also, the school fee is less than what? What we are charging here is only less than the school fee.
Yeah, in the university, the cost is about 8,000 Singapore dollars.
For how many years? For how many years?
Or at least 3 to 4 years. Yeah.
So 8 into 4 years, how much? 32,000 Singaporean dollars.
Yes, that's right.
Indian
And
charges are
what are the
20,000 here. School charges 20,000 here in Bangalore. More than
which
that.
school? More than that. In school itself.
Primary school.
For primary school, we are in Indian currency, we are paying how much Singaporean dollars? We are paying around more than 1,500 Singaporean, 2,000 Singaporean dollars in the primary school. What I will say about the university level. And this is a professional degree. Even for the kid who is studying in a simple mediocre school in my Guwahati, we are paying how much Singaporean dollar? We are paying per year more than 2,000 Singaporean dollar on her. She is in class 3. Oh, no, 2. So I don't know. We have to change our mindset. And my niece is not studying in a hi-fi school. She is studying in a mediocre school. That part we have to understand. Anyway, thank you so much.